Hi all, welcome back to Nursing Guru. Today we are going to discuss about the medical surgical 2. Okay, so that you are already waiting for that, right? This examinations is there for tomorrow, medical surgical nursing 2. So here I am gonna take a class which is related to the medical surgical nursing part 2. Yesterday we have discussed lot of things which is related to part first. Now we are going to discuss about the part 2. Total we have the 11 units. Okay, so by initial itself I will start to give important questions as well as the regarding the particular unit also I will tell. Okay, so most of the time you take a important questions. Okay, so that is very important for you to get a good marks. Okay, so oncology nursing is the first unit. Okay, so we will start with the first unit number 1. Okay, unit number 1, oncological nursing. So oncological nursing, so here in this particular unit we are going to study about the things which is related to the cancer. Okay, so in the cancer we are going to study about the nursing management, especially nursing management of the cancer patient, nursing management of a patients with the oncological conditions which is cancer. Okay, so here you are going to study about the benign and the malignant cancer also. So and meanwhile what will be happen, you know, my dear students, you have to study about the cancer cell structure, characteristics and normal and characteristics of normal and cancer cells. Okay, so the structure and characteristics of a normal and the cancer abnormal cells you have to know. Prevention, screening, early detection, warming signs of cancer, epidemiology, etiology, classification, okay, pathophysiology, staging, everything you are going to study. Clinical manifestation, diagnosis, treatment, that chemotherapy. Okay, so these are the things will going to be there. Surgical interventions, okay, regarding the various types of rehabilitation, psychosocial aspect of the cancer. Okay, stomal therapy, special therapies. Next one, psychosocial aspects, nursing procedures, alternative therapies, drugs used in treatment of oncological disorders are the major important things we are studying in the this one. Okay, so we are studying in this particular unit. Okay, so let me see now. One by one question I will tell. Okay, so you start to take the questions. Okay, so here it is medical surgical second according to the GNM board. So the questions are like, you know, define cancer, explain the causes, warning signs and diagnosis, treatment and nursing management of the cancer. First question. Okay, so the next one is explain the nursing management of the patient receiving the chemotherapy. As a nurse, whatever the management you have to do done by your side, so that is what receiving the chemotherapy. Describe the nursing care of patient undergoing radiotherapy. Okay, so this chemotherapy, radiotherapy must and should you have to know. And discuss the palliative care. This is very important. Palliative care in terminally ill cancer patient. Okay, so these are the things you have to focus more in this particular first unit. Okay, so then short note type of questions, types of cancer. We have that TNM staging and as well as chemotherapy, radiotherapy, hospice care. Hospice care is the important. Biopsy, metastasis, carcinoma, leukemia, tumor markers are the very important 1 mark, 1-liner questions. Okay, so these are very important. Let me finish it off by this and now we will go with the unit number 2, burns, reconstructive surgery. Burns is a huge topic, my dear students, that you have to study. Means you have to involve yourself at least 1 hour. So even I will cover with whatever the thing it is there now within this class only I will cover which is important. Before going to burns I will speak about the things which is second unit, that is the nursing management of patient with the breast. Okay, so breast, mammary gland, whatever the things which will be causing disorders, breast disorders we are going to speak. So history, physical examination, diagnosis, this assessment of breast related disease condition. And next one is disorder, mastitis, breast abscess, and next one is gynecomastia. Okay, this one the condition which we can able to see in the male. Okay, so this gynecomastia is you can able to be what you can expect in the 1 marks question also. Defined by gynecomastia, or they will ask gynecomastia. Okay, so by the time you have to tell. Okay, mastitis, infection and inflammation of the mammary gland. Okay, so breast abscess will be formation in the breast. Next one, tumor and malignancy of the breast breast cancer is one of the high yielding cancer we are seeing in India. So that is how and its management, patient after mastectomy. Ectomy means what? Removal. Okay, so removal of the breast. Okay, so this surgical care also you have to write whenever you are going to write about the mastectomy, if they are asking about this question. Okay, so from this unit, describe define breast cancer, explain the surgical procedure for breast cancer, which is mastectomy, like that kind of questions. We are expecting the one liner like gynecomastia, breast abscess and mastitis, and tumors and malignancy of breast cancer. Okay, so one second. You have to do the things like, you know, nursing management of patient with the diseases, disorders of the breast related things in the second unit. Okay, so first unit oncology, second unit breast nursing management of the breast disorders. So the next thing what you have to focus means, you have to focus on the things, you know, which is related to the third unit. So the third unit is nursing management of patient with the disorders of integumentary system, which is integumentary. So integumentary means skin. Okay, so related to the skin, whatever the conditions which will come, so that system you are going to be study. Okay, so the etiology, pathophysiology, clinical manifestation, nursing management of disorders with the skin and its appendages. Okay, lesions or abrasions. Or okay, 1 marks questions you may get what are abrasions. Okay, so the next one, infection and infestations of dermatitis. Next one, dermatosis, infectious and non-infectious. Okay, in that also two types is there, infectious dermatosis and non-infectious dermatosis. Both also you have to study thoroughly. Inflammatory dermatosis and acne vulgaris. Okay, so and after that allergies, eczema, psoriasis, okay, malignant melanoma. Okay, so oma means cancer. Okay, next one is alopecia, infestations, bacterial infections. Then next one you are having a impetigo. Okay, vitiligo. Okay, these are whatever the herpes zoster, herpes simplex, fungal infection, athlete's foot. Okay, next one we have lot of scabies. Okay, so scabies, pediculosis, everything will becomes under this integumentary only, that you study properly. And in this only burn and its management will be there. So when it comes to the burn, so burn is the biggest topic that you have to study at least 1 hour. You will take 1 hour to 1.5 hour to thoroughly know about the burns. Okay, so let it we will know about this burns means, so first degree, second degree, third degree classification you have to study thoroughly. Okay, based on that first degree superficial burn. Okay, so that kind of clarity you should have between the next type. Okay, so that is one of the very very important burn topics. This plastic surgery, cosmetic surgery. Okay, so this plastic surgery is one of the very important topic in the burns. And incidence, causes of burns, types and classification of the burns, rule 9, rule Wellach 9 will be there, no? So that calculation of the percentage. Okay, so how to calculate that one? Okay, so suppose if it comes to burn, no, so this is the dorsal area, so this is 9%, anterior, posterior, this is 4.5%. Okay, so this is 4.5%. So anterior, posterior hand. Okay, so this is torso, upper chest region, it is 9%, and here it is 9%. So this is how we are calculating. So in the same also, here also 9%, 9%. Okay, so 99% anterior posterior. So this is how the Wellac rule 9 will be there. So randomly I have written this one, okay, so that you have to go and study thoroughly. Okay, understood? No. So now I will tell you the burns management and plastic surgery, incidence, causes, everything over. Then calculation of percentage, local systemic effects, burns, and immediate care, first aid care. Okay, so what kind of care? So what is we are going to supposed to do? So we are going to mainly focus on the electrolyte therapy. Okay, so means we are going to fluid therapy only is the thing that we are going to mainly doing in the burn case. Okay, so this one first immediate care, what is the immediate care, what is the first aid care. Okay, so in the first hour, in the first next hour, okay, like that only we are going to be, once the incidents will be happen, once we will get into the hospital, what immediate care you have given. Okay, so what is the first aid care, what is the immediate care, that you have to study, and plastic surgery. Okay, after that alternate therapies, drugs used in treatment of integumentary disorders will be there in the this one. Okay, third unit. Then ophthalmology. Ophthalmology, we have again assessment of these disorders, and we have this certain disease conditions also, like keratitis, corneal ulcer, trachoma. Okay, so then conjunctivitis, these are the related main topic I'm telling. Okay, so related to eye, whatever the diseases will be there, that one. Next, fifth unit. Okay, so fifth unit we will move. Listen, in the fifth unit, nursing management of patient with disorders and disease of ear, nose and throat, ENT, what I am calling ENT. So in that ENT, what will be happen? Whatever the disease condition will be there, right? So those are the disease condition we may get in the exam. Okay, so for example, glaucoma. Okay, so for example, we have ENT, sorry, not ENT, eye. Okay, so this glaucoma will come in eye, foreign body, then it's acid and alkaline burns, trauma to the eye. Okay, these are all comes under the ophthalmology. Now I am speaking about the ENT. Okay, so ENT. So integumentary also over. Integumentary. Okay, next one we have seen this. Burns also we have seen. After that, ophthalmology, okay, opto, which is related to eye. Okay, so next one, we are having the things like, you know, ENT, ear, nose, throat. Okay, so external ear, middle ear and internal ear, so and deafness. These are the four things very important here. In the external ear, external ear, we have seen that otitis media. Okay, otitis, foreign body and impacted cerament, and we have the furunculosis. Okay, so these are the things we are expecting from this particular unit, and as well as in middle ear, otitis media, mastoiditis. Okay, so perforation of the eardrum will be there in the middle ear. Okay, these condition you have to focus. Internal ear, we have this labyrinthitis, Meniere's disease, otosclerosis. Okay, otosclerosis is the in the internal ear. Okay, inside the ear, whatever internal ear, these conditions you have to, Meniere's disease and all you have to study. Next, deafness. Okay, deafness management, everything you have to study. And nose, when it comes to the nose, rhinitis, sinusitis, obstruction, polyps, foreign body, deviated nasal septum, trauma, fracture of the nasal bone or epistaxis we can see. And throat, when it comes to throat, we have the things like tonsillitis, pharyngitis, then adenoiditis and laryngitis, tumors, and we have injury to the foreign body and the foreign body, and have alternate therapies and drugs used in treatment of ENT disorders. Okay, so these are the very important thing that you have to focus more. Next, nursing management of patient with cardiovascular, circular and hematological disorders. Cardiovascular, all related to heart. Okay, so in this heart, coronary artery disease, arrhythmia, coronary artery disease only, in that diseases also we have that the things, you know, we have the things like, you know, mitral stenosis, coronary artery diseases, angina pectoris, coronary atherosclerosis, myocardial infarction, next one is valvular heart diseases ಅಲ್ಲಿ mitral stenosis, aortic stenosis, okay. So incompetence, regurgitation, okay. So the next one is that tricuspid stenosis, and we have the pulmonary stenosis. These are the things will comes in the valvular heart disease. And inflammation and infection like pericarditis, myocarditis, endocarditis, rheumatic fever, and heart block, complications of the heart diseases, acute heart failure, chronic congestive cardiac failure, congestive shock, okay. So all the things which is related to the heart. Next one, hematology. Hematology, the circulatory system will completely going to be with the heart as well as the blood. So here you are going to study about the anemia, thalassemia, polycythemia, and leukopenia, okay, leukocytosis, lymphomas, okay. So this one, and bleeding disorders, thrombocytopenia, purpura, hemophilia, and acquired coagulation, okay. So this coagulation factors will be there, 8, okay. So that and all you have to study thoroughly. Next one is related to next unit, which is related to the communicable disorders, all the communicable disorders, okay. So from one person to another person, whatever the things will going to be transfer, no, measles, chicken poxes, swine flu, ebola, dengue, okay, influenza, mumps, okay. So these are the things are very very much important, so that you have to study, and that management also very easy. So vector-borne diseases, list out the vector-borne diseases, they may ask in the communicable diseases, okay. Next thing is sexually transmitted diseases. Next unit number 8, sexually transmitted diseases. So here you are going to mainly focus on the gonorrhea, syphilis, granuloma, and as well as the AIDS and genital herpes. This much thing will be there. And next is that we have musculoskeletal disorders, okay. So and its management, septic arthritis, okay. So osteomyelitis, tuberculosis of the spine and bones, okay, sprains, and we have the dislocations, fracture of spine and extremities, okay. So these are the things will be there. Crutches, canes, walker, okay. So use of orthopedic assisting devices, so those are the devices, list out the devices used in the orthopedic, okay. So like that also there is a question they can ask, so these are very important. And emergency management, 10th unit is emergency management. In the emergency management you have to focus more on the airway obstruction, medical surgical emergencies, whatever the medical surgical emergencies will come, now list it down and study that one. And hemorrhage, shock, anaphylactic reaction, allergies, trauma, intra-abdominal, okay. So and next one is that crush injuries, multiple injuries, fracture, poisoning. So these are the emergencies, okay. So these emergency disorders, how we don't know when it will happen, okay. So we got emergency and we have to take this one, and we have to give a proper care towards the emergency. So that is what management, okay. So those are the things are very much important. And last unit is that emergency and disaster nursing. So flood, earthquake, volcano eruptions will come, no. So that is the unit you have to know already very well, I know that, okay. So these are the things. From burns I will tell you, define burns, explain the classification from the integumentary, okay. Classification, complication, nursing management of the burns, okay. Describe the fluid resuscitation mode. This is the one of the important management we have to do in this one, okay. So this is for second JNM, okay, who are watching, no, second GNM this video. So and moreover you listen, fluid resuscitation in the burn patient, explain the rehabilitation of the burn patient. This much things you have to study thoroughly. Next one we will move with the short essay, rule of 9, burn shock, skin grafting, burn dressing, prevention of infection, okay. So these are very important. Next one we can go with the things which is related to eye disorders, explain the cataract and its nursing management, describe the glaucoma types, clinical features and treatment and nursing care, blindness, eye donation, retinal detachment, corneal ulcer, conjunctivitis, myopia, hypermetropia, cataract, glaucoma, tonometry. Okay, so these are the important topics you have to study. Next one, disorders of the ear, nose and throat. ENT is there, no? ENT. So explain the otitis media. Very much important. You may get this question in the long essay type of question. Otitis media is one of the brand high yielding topic. Okay, so and nursing management. Describe the tonsillitis and post operative nursing care for the tonsillectomy. So now it will come into the ectomy surgery. Write about the 5 P's in the okay, so this 5 P's in this pre-operative and as well as the post-operative, and you have to write about the entire surgical management you write. That is very easy to write it also. Next one is that describe the tonsillitis is over, right? Hearing loss, epistaxis, sinusitis, tracheostomy care, otoscope with vertigo. Okay, so vertigo will be there, so suddenly they will be feel faint and all. Okay, so next one is that laryngectomy, mastoiditis and infection and inflammation of the mastoid bone, mastoid process. Okay, so next one is deafness. Okay, so this and all will be very important. And orthopedic disorders, okay, musculoskeletal, from that unit explain fracture, classification of the fracture and treatment and nursing management. Describe osteomyelitis and nursing care. Explain traction and nursing responsibilities. Hip replacement, osteoporosis, arthritis, plaster cast care, amputation. Amputation is very important. Cast, splint, traction, crutches and dislocation. Next one is disorder of skin. Okay, so explain psoriasis and nursing management. Explain or describe the eczema and nursing care. Fungal infection, dermatitis, scabies and pediculosis. Okay, so these are all very important. And next one, acne, melanoma and ulcer, pruritus, infection control. Okay, so these are the things will be there. Communicable diseases. When it comes to the communicable diseases, we have the things explain tuberculosis, causes, diagnosis, treatment and nursing management. All the communicable diseases study. Importantly, you have to focus on the tuberculosis, HIV, AIDS and dengue fever, and we have the malaria. So these are the, and vector, list out the vector-borne diseases also they may ask. Okay, so that is very important. Then hepatitis, and today is the World Hepatitis Day. Okay, so next one is that COVID-19, typhoid, rabies, leprosy are the things. And write about the treatment modalities like DOTS, ELISA is for HIV, DOTS is for tuberculosis, and ART, MDR, TB, isolation. Okay, so this much will be there. Emergency and disaster management. Explain disaster management and the role of the nurse. Okay, describe the CPR, cardiopulmonary resuscitation. Explain triage in disaster management. First aid in poisoning, shock management, snake bite, drowning and poisoning, heat stroke will be the short note kind of things. Okay, CPR, triage, disaster, AED and emergency kit. Okay, so most related topics you have to focus more on the cancer, nursing management, burns and nursing care and stroke. Okay, so especially CV. Okay, so that you have to cerebrovascular accident. Okay, next one is that cataract, glaucoma. So stroke you remove because they are not supposed to ask here. Next one is glaucoma, fracture and nursing management, tuberculosis, HIV, AIDS, disaster management, CPR and traction and nursing care. Okay, so rule of 9, chemotherapy, burn shock and Glasgow coma scale, seizure precautions, GCS not they are going to ask here. Tracheostomy, cast care, DOT strategy, ART therapy, triage, shock management. Next, 1 mark, define cancer, mastitis, burn shock, stroke, epilepsy. Okay, so these are the things will be there in that. So most of the time you are getting these questions. Okay, traction, tuberculosis, HIV, disaster, triage, CPR. Okay, so traction and epilepsy, these are the very important questions you have to focus more from this particular unit. Okay, so hope you guys are get all the questions. Reminding, ma'am, first sem result date. Afzal vlogging. Okay, first sem, take a time, da. Now only they are doing this evaluation. Last Sunday it has been started. The evaluators keep on doing the evaluation. Once it will come, once the practical exam is which will be finished for all the semester for the exam, definitely you will get it. Okay, so we have lot of time to get the result. Okay, so you can expect from next month. So they also have time, no, they have to breathe a little bit. Now only they have conducted exam, and they have conducted and they have finished, but still practical examinations are going on. You people already know that, and they will definitely going to be. Is there any doubt? Means you can ask now. uh, so I will clarify you. Okay, is there any doubt? Okay, so these are the major components you have to focus more. Okay, so why I'm little bit fast, I know that. Why I'm, so you have to have the time for study also. Okay, only the important questions whatever I have given, study it. Okay, study thoroughly. You will definitely get those questions only in the examination, tomorrow's examination, and you will get pass. Okay, while writing the answer also, I will tell about the answer writing this one. Okay, so this is the page, right? So start to put a big heading. Okay, suppose you are writing about the cancer, okay, or gynecomastia or any topic. Okay, so try to put a big one heading. Okay, so try to start with the intro. Okay, so there is no need of intro personally, but even though people used to write, no, from your classmates and all, you also practice this one, that I know. Okay, so intro, then write the definition. Okay, so definition, two definition you have to write. Okay, so after that, whenever you are writing the definition, write it off according to whom and which year, 2007. So same like this you have to write for two definitions. Next we will going to be start with medical surgical alle. So medical surgical, we have to focus more on elaborating the answer which is regarding the disease condition, right? So you have to write about the disease definition, finish, and write about the causes, etiology. Okay, so try to write about the etiology. After that etiology, clinical manifestations. Okay, clinical manifestation, you have to write about the pathophysiology. If necessary, you write it down. It is easy also, you can write it down. Next one, that after pathophysiology, write about the management. Okay, so in that management, medical management, under that pharmacological management, write the drugs name. Okay, so this is how you need to write. Next one is that after the pharmacological management, if it is there any kind of surgery, write it off surgical management. So there you split it off pre, intra, post. Okay, so pre means before the surgery, write it down 5 P's. Okay, physical preparation, physiological preparation, pathological preparation, psychological preparation, and pre-operative preparation. Okay, under that you can write it off. Okay, so all P. Next, this is intra you are going to check the vitals and manage the patient. Okay, so if any kind of things will be happen, you will going to be take care of the patient. That is the only thing you have to do. And next, post. Okay, so in the post, what you will do? Airway, breathing, circulation. Okay, drugs, elimination. Okay, so this is how you are going to be write it down in the exam. Okay, so this is all about the surgical management. Now you finish. Okay, so now next, nursing management. Okay, nursing management, provide a care, comfort, privacy. Okay, so administer the medication as per the doctor's order. Okay, so all these things if you have written. Okay, so after this, sorry, here only, before going to write the which one is that management, to write the diagnosis. Okay, so diagnostic evaluation. Okay, so diagnostic evaluation you have to write. After that management you write. Okay, so after this one, if you have written like this, nursing management, if you complete means write a nursing diagnosis, or else before going to write the nursing management, to write the nursing diagnosis. Okay, so nursing diagnosis, what you are going to supposed to do, my dear students? So you can go and write whatever the acute pain which is related to the disease condition as per the facial expression, or as per the movement of immobilization, okay, immobilization of the leg, foot, okay. So we are having no so knowledge how to diagnose the things, so what on the basis of what we are diagnosing. So that is the only thing you have to focus more, okay. So this is the thing, okay. So hope you guys have got everything. After this, try to put a 2 to 1 care plan, one. So only write go nursing diagnosis, okay. So nursing diagnosis, goal, planning, planning. Next one, you have to focus on the thing is evaluation, okay. So there is no patient for evaluation, you can write it off, you no need to write, only till planning you write, okay. So this much is enough, planning or intervention. So intervention you are not going to write, planning only you write, okay. So planning like that you write, planning or intervention both are same. So in next one is implementation, that is what you have done, so no need to write it. Rationally you can write according to new Nanda diagnosis, we are not right now following, okay. So okay, these are the things you have to follow. So far we have discussed all the important questions, hope you guys are get it down. I will wind up today's session, we will meet you in the next class tomorrow, okay. So tomorrow also will be live is there, so don't miss the live, attend, okay. So whatever the doubts if you have, you can ask me also in this live chat. Let me finish it off, I will wind up my live. Thank you.